Hi, Dr. Yass here. Today I want to talk about an issue that must be understood if you're ever to recognize that what is being done to address your pain is simply invalid and in fact will never resolve the pain. It is the idea that chronic pain is actually an oxymoron. Now, you must appreciate that the phrase oxymoron applies to the idea that two words are joined that actually have opposite meanings. In the case of chronic pain, this could be understood in the sense that pain develops as a result of a tissue in distress. So the acuteness of the signal of the pain occurs at the time a tissue has distress, and the tissue itself is eliciting the symptoms being experienced to create conscious awareness of the distress of the tissue. So a tissue in distress tries to make your brain aware that it's not functioning properly, and it does so through the emitting of symptoms. So the symptoms that you experience are actually occurring at the initiation of the distress of that tissue. The idea is that once the tissue elicits the symptoms and the brain becomes aware of the distress, an attempt to perform an intervention is provided to resolve the distress of that tissue. And if in fact the distress of the tissue is resolved, that tissue no longer has the need to emit the emergency protective distress signal of pain, and it simply ceases. So, if we recognize that pain or any other symptom develops at the time that a tissue is in distress, then we should recognize that if the tissue can be resolved in a short-term fashion, then the idea of pain should never be more than acute. This is probably the most critical thing that's lacking in the mindset of the layperson who's suffering with pain. There has been a cultural variation or turn towards the idea that chronic pain is something that should be accepted, that somehow it's actually valid. Chronic pain does exist and should exist. We have a medical system that's actually pushing this theory by promoting the idea that chronic pain is the result of chronic illness. That pain should be perceived just as cancer or diabetes, that there is some form of long-term treatment required. I can't explain in enough words how irrational this mindset is. When we talk about cancer, or we talk about cardiovascular disease, or we talk about diabetes, we're talking about distress of a tissue. The heart is not functioning properly. The kidney is not functioning properly. The pancreas is not functioning properly. So in these cases, we are referring to a tissue. Pain is not a tissue. Pain is a signal from a tissue in distress. So the idea that you should ever have this distress signal for any period of time is a reflection on a medical system that's incapable of identifying the tissue in distress and thereby being able to perform the proper intervention to resolve the distress of the tissue. How can you not see it this way? When I do these videos, my attempt is to educate the layperson, the person who is suffering, who is having pain for a sustained period of time, continues to get treatment from a varied group of medical specialists, physical therapists, chiropractors, neurologists, podiatrists. You could get pain management. You could have an orthopedist, a neurologist. You're getting all these people trying to treat you. And they may be all well-intentioned. But if you go back to the core principles of what pain is, you have to recognize that if, in fact, treatments are being provided and pain continues to exist, there is no alternative but to recognize that the wrong tissue must be being treated. If the right tissue is being treated and distress of that tissue is resolved, the tissue itself no longer has the need to elicit the protective emergency signal of pain. It simply ceases. We need a cultural shift. We need people to understand some very simple core principles regarding pain. Pain should be acute, never more than acute. If you're having a heart attack and you have pain at the chest and the left arm, that initiates your awareness that you're having a heart attack. You're immediately brought to a medical practitioner to address the heart. Certainly within the next day or 2 days, some sort of intervention is provided to resolve the distress of the heart, and the pain at the chest resolves. The pain at the chest and the left arm resolves. It's within a day or 2. If you're recognized to have a kidney stone, you get some sort of treatment, whether it's to dissolve the stone or whether it's to pass the stone. But ultimately, as soon as that stone passes, the pain resolves. We can say this in almost every fashion of the way the body works. The problem lies in the false premise that the MRI is the mechanism for diagnosing the cause of pain at the neck, back, or extremities. Because over the last 30 years, people have been culturally programmed to believe this is valid. And to be very honest with you, even the medical practitioners who are trying to resolve your pain actually believe, because they've been taught to implement this mechanism, that it's valid. The sad reality is that there is no basis that the MRI is valid. Finding structural variations like herniated disc, stenosis, arthritis, meniscal tears, labral tears, compression fractures, all the structural variations that have found have been there well before your symptoms began. The idea that it's the cause of your symptom simply because it's identified at the time that you're having your symptom is correlative theory. It's simply saying that because one exists at the other, as the other exists, one must be causing the other. It's pure fallacy. It's called junk science. You can see this in a multitude of areas, as I've stated. It's not really even a medical analysis. It's a statistical and scientific analysis that proves that it's baseless. So if you're being told that the cause of your pain is from a structural variation, that is to say that at the immediate time your pain began, that's when that structural variation began. If it's the cause, it must occur at the time the pain begins. But anyone who knows anything about these structural variations, they're very slow and progressive in nature. They're more like wrinkles than anything else. They're just happening inside your body. But the reality is that they're very slow and progressive in nature. So if you had taken an MRI prior to your symptoms, a year or even 5 years prior, you would have seen those structural variations were there. On the other side of it, if in fact structural variations cause pain, then people with no pain should not have structural variations. But you can see studies that show that basically the same percentage of people who don't have pain have the very same structural variations in almost the exact same percentages. This is what is known as an independent variable. I like to show people this in the sense that if I was to say that right hand dominance is caused by herniated discs, I can do a study and check all the people with right-handedness, and I might find 90% of them have herniated discs. So you would say, wow, that's a very high percentage of people having herniated discs. Therefore, it sounds like herniated discs do cause right-hand dominance. But for every hypothesis, there's something called the null hypothesis, which is the opposite, which is to say that left-handed people should not have any herniated discs. If right-handed dominance is caused by herniated discs, then left-handed people should not have them. And if you were to do a study on left-handed people, you would find roughly 90% of them have herniated discs. So when you find roughly the same percentage of the variable you're looking at in both sides of the issue that you're trying to establish is there a connection to, that means the variable is independent. So if we find 90% of people with right-handedness having herniated discs and 90% of people with left-handedness having herniated discs, that implies there is no connection between herniated discs and strong side dominance. The same thing can be found in the relationship to pain. As many people with no pain can be found to have the same types of structural variations as those with pain. It's the same exact correlation. It's called an independent variable. It's saying that structural variation can be found in as many people with pain as no pain. Therefore, pain is not correlated to structural variations. That's why chronic pain exists. That's why this oxymoron, this thing that should never exist, exists. Chronic pain should never exist because pain should never be more than acute, if in fact you properly diagnose and treat the tissue in distress. I'm not trying to attack any one particular specialty or any one practitioner. What I'm telling you is that there's been a cultural shift in the way that the medical system identifies and addresses pain. And it is simply the fact that the MRI is perceived to be the standard of care. It's a fallacy. You are being programmed, even on television with commercials, that nerves cause pain. Nerves cause pain. Every time you have a pain, it's a nerve. It's a nerve. It's a nerve. Nerves don't cause pain. Nerves transmit the signal of pain. Tissues cause pain. And surrounding the tissues are connective tissue that hold pain receptors, and the pain receptors are ignited when the tissue elicits the pain and then sends a signal to the brain through a nerve. So it's not the pain signaler, the pain receptor, it's not the nerve, it's the tissue. If you could recognize that, then you actually have a chance to understand that you must be able to identify a tissue. You cannot jump to the conclusion that nerves cause pain because in almost all cases, nerves are not the tissue causing the pain. It's simply the tissue that's transmitting the signal of pain from the tissue in distress. The important thing to mostly understand is that not all causes can be identified on the MRI. In my 25 years of treating patients, I've been able to show that in 95 to 98% of cases, the cause of pain is muscular. It's actually muscle that's involved in the eliciting of the symptom, and muscular causes will never show up on MRIs. And there is no medical specialist capable of diagnosing these. So what you see is that the reason that chronic pain exists, even though it is an oxymoron, is because there really is no true mechanism in the medical system as it is performed today that can identify the tissue in distress. Only the Yass method can. The Yass method interprets the presentation of the symptoms to help you identify which tissue is in distress. In 95 to 98% of cases, it's muscle. If you want to get more information about the Yass method, you can contact me at my email address, drmitch@mitchellyASS.com. And you can get more information at www.mitchellyass.com. For now, this is Dr. Mitchell Yass wishing you a